All right, welcome back everybody. We're here to give you a surprise third show for this month. So really what's going on is that we are seeing some changes in what's happening with the epidemiology out there. And we have some new tools, or Gary's put together some tools that we thought would be very, very helpful, particularly for our providers who are treating these patients in the ambulatory setting. And we didn't want to wait a couple weeks to get that out to you because we thought it'd make your life better. So,
yeah, and a big shout out to Erica because she's going to provide extra CME for this video. So I really think that's tremendous. Good. So thank you very much, Erica. I'm not sure what we'd do without you.
All right, let's start with the epidemiology. So we've seen this before, but I just want to remind you what's going on. This slide talks about the Bay Area, the Sutter Bay Area, and it shows that the positive 7-day moving average continues to climb about 7.5%. But remember, this is symptomatic patients, and as you're going to see, we're probably not going to be able to rely on this for two reasons. One is we're seeing fewer people with symptomatic symptoms go to the doctor, and secondly, more and more people are testing at home, and we're not able to capture that. The slide for Sonoma County looks similar to this. The positivity rate has doubled over the last 2 weeks since we presented to you. But Gary, you had some more information about what is actually changing.
So I'm going to show a slide that shows the system, and I really like this. This mirrors the epi slide for Sutter. This is a Sutter slide, and it shows broken down the positivity rate for ED patients, ED asymptomatic patients, outpatients with symptoms, and outpatients that are asymptomatic. And as you can see, where I put the red arrow, outpatients with symptomatic disease is going up. And right now, we don't have anyone in the hospital who's COVID positive and symptomatic. So what we're seeing is the outpatient setting go up much more than even the hospital setting or even the asymptomatic setting. Now the next slide comes from the New York Times. I really like the Times. They kind of show this is a US trend, and as you can see in the US, and we're going to tell you why in a little bit, but in the US, testing is going up. So even with home testing, which is not reportable, the testing that is reportable is still showing an uptick in cases, but hospitalization rates are going down. And that's the lower section of this. So again, this kind of confirms that this is now moving into an outpatient. So we have this novel pandemic that's now moving into an endemic season, and the virus is becoming much more adept. It's mutating along the way, and now it's become more of an outpatient disease in those that are vaccinated or with natural immunity.
Okay, well, let's follow that concept because you've got some more information on a new variant that's kind of following that pattern.
Yeah, so when the Delta strain came out, the Delta strain mutated because remember, this is an mRNA virus. It's an mRNA virus that doesn't really go back and check itself, doesn't correct all of its mutations. And so because it doesn't correct all of its mutations, a lot of variants kind of come out of that. So when the Delta strain was being tracked worldwide for its mutation rate, there were probably 100 subvariants. So then Omicron came out. Omicron is more contagious than the Delta, less severe, and it became the predominant virus. But as the Omicron strain continued to replicate in humans, it actually started to mutate. And that's where the subvariants came out. BA1, BA2, BA3. Now there's a BA4 and a BA5 in parts of Africa and Europe, not in the US yet, but that's being tracked. The subvariant BA2 has also been mutating. And there's a new subvariant of BA2 that's a little bit more contagious. So the way we track this in the US, Human Health Services track this by regions. And I'm going to show you a couple graphs. So these are weekly testing. And to the far right is the most recent week. Now this is Human Health Services Region 2. This represents New Jersey and New York. And as you can see to the far right, 45% of the strains being sequenced are BA2. So subvariant of Omicron BA2, but in the orange there, 52%, as you can see, it's gone up week by week. This is a subset of BA2.
So a new variant.
Well, not a new variant, but a new subvariant. Yeah, new subvariant of BA2.
Okay.
Which is about 20% more contagious. Not 200, not 20 times, 20% more contagious. So more viral fitness, more viral burst, but not more severe. And that's why New England is seeing an uptick of cases. So yes, it is all BA2, but it's also a BA2 subvariant. Now, to the right, the graph I'm going to show you to the right represents Human Health Services Region 9. And this represents Arizona, California, Hawaii, Nevada, and some other areas like American Samoa. And as you can see to the far right, 85% of what we are seeing right now in California and on the West is BA2, the typical subvariant of Omicron. And the subvariant of BA2 is only 8.8%. So I think we're lagging behind New York. I think we're lagging behind the East Coast. And in a few weeks, you're going to see much more outpatient disease and only inpatient disease in probably unvaccinated people.
Okay. And this is kind of my understanding of the evolution of a virus. Is their goal is to survive, so they want to be as contagious as possible but not lethal.
Right.
And that's what we're seeing this trend over time is these variants are getting less and less lethal, i.e. less serious disease, hospitalizations, more contagious hitting the population, but it's the ambulatory population that's getting sick.
That's right, and that's probably very much what happened with influenza in 1918.
Yeah.
Because over 4 or 5 years, it took the virus to become much more endemic and less lethal. And that's as we adapted to it. So only the strongest survive, but those that survive have a more mild illness of it. Ours is compressed into 2 to 3 years because of vaccination.
Yeah. So Gary and I view our role here as primarily educational, so we can all learn about what's happening. But secondarily, our role is to make your life easier. So for those of you who are seeing COVID patients or treating COVID patients or hearing from them in the ambulatory world, we want to make it as easy as possible for you to survive in this new phase where people are reaching out to you, they're not that radically sick, but there's treatment available to them. So you're playing a more important role than perhaps we did when the ICU was the focus. So Gary has created some cheat sheets, some flow sheets that really, I think, make it so much easier to practice in the ambulatory environment. And that's part of the reason we're here today is to introduce that. He's going to talk about how he's going to get that out to you.
Yeah, so first of all, I want to shout out to Jill. So Jill Rushton Miller has a couple great dot phrases, and we're going to socialize them with everyone. I'm going to show them just kind of briefly. The first dot phrase is called AFM COVID high-risk patient message. This is what she sends the messages, and I kind of broke it up into 2 so you can read it here. Based on your health and history, I believe you may be at high risk for complications of COVID. We have new medications. That can be prescribed to reduce someone's risk of complications, and then a lot of drop downs there. So a really good dot phrase when you're MHO patients through EPIC. And then the next dot phrase, she has lists, and it actually, in a note, it'll pull in data for who is high risk. So, treatment is designed for patients who are either unvaccinated, very old, or have high risk comorbidities. So Jill's put all of those into this really good graph. We actually went through this and made sure it coincide with the CDC guidelines, because sometimes they change. And this is a really good match for what the CDC guidelines are. So a big shout out to Jill Rushton Miller for the dot phrases. But I think what I've done, Gary, and hopefully this is helpful to everyone, is I'm going to, today, I'm going to record a tutorial. It's going to be like a mini grand rounds. It'll be short. It'll be in PowerPoint format. And it's going to walk through different scenarios for when you're a primary care doctor on how to approach treatment and how to make decisions on treatment. And also which treatment to use, what's the most up-to-date treatment. And I think that's really going to be important. Now the Sutter guidelines that have come out are 7 pages long. They've compressed inpatient and outpatient treatment. And it's a little bit hard to follow in real time. So over the weekend, I thought, what would really make it super easy for a primary care doctor to make decisions really quick? And what information do they need to have at their fingertips, like all the drug interactions with Paxlovid? I found a very good 1-page handout from the University of Liverpool that showed a great table on which medications you want to avoid with Paxlovid. So if we can put that into a tutorial, the plan is to send it out by email today. And then I'll also send the slides in email form in PDF. So if you want to print those slides, if they're helpful to you, put them next to your desk with a couple of these handouts. That would hopefully make your life in the outpatient arena easier. I think we're going to see much more outpatient disease. And I think our primary care docs and the urgent care docs, they need to have these really quick skill sets and these quick references so they can make decisions on the fly without having to dig through, CDC guidelines, NIH guidelines, Sutter's 7-page document that kind of compresses everything.
Good. So to summarize, what they're going to be sending out is a Teams recording that he's going to walk you through the flow sheets, and a separate attachment of those slides that you can print and tack them on the wall, at least have them at your station to help you out. And then the last thing I wanted to show you, just some slides that I thought were very useful. Also, we'll include this in the attachment. You can print it if you want to. Is this, there's so many vaccines now, and the age groups, it can get confusing. So this is put out by the county, and it shows you the dosing for the different vaccinations, ages, and so forth. There's this one for routine. There's a separate one for immunocompromised people. We'll tack this in with the attachments so that you can print it if you find it helpful. So that's why we're here. Hopefully this will make your life easier. Have a good weekend.
All right, thanks everyone.